Hello, I am Dr. Lauren Nye, and I will be presenting our poster on ePost BC, Incorporating Telementoring into Practice, Efficacy of Point-of-Service Testing in Breast Cancer. It is estimated that over 300,000 breast cancers will be diagnosed in the United States this year, and as high as 14% may be related to a hereditary cancer syndrome. In Kansas, similar to other rural and socioeconomically disadvantaged communities, the majority of patients diagnosed with breast cancer and meeting NCCN criteria for genetic testing have not been tested, and this burden will continue to grow. We initiated a multi-component quality improvement and educational intervention utilizing Project ECHO to improve the knowledge and practice gaps among community and rural oncology providers surrounding genetic testing in patients diagnosed with breast cancer, and providing tools to allow genetic education and testing to be incorporated into clinical practice. Project ECHO is a combination of didactic and case-based learning focused on knowledge as well as change in practice. It uses a hub and spoke-based model where content matter experts are connected to community care teams. 10 rural and community cancer care teams from the Masonic Cancer Alliance, which is the outreach network of the University of Kansas Cancer Center, were invited to participate. 5 one-hour Project ECHO sessions hosted over Zoom covered the clinical process for genetic testing, guidelines for testing, interpretation of test results, personalizing oncology care, and the multidisciplinary approach to management of hereditary cancer. An optional process improvement component included workflow analysis and data collection of analytic cases of breast cancer and genetic counseling and testing completion rates. This map demonstrates the location of the participating cancer centers across our state. Using Moore's model of outcomes assessment, we were able to assess participation, satisfaction, learning, and competence. We had a total of 76 cancer center staff participants in this project. The majority were clinical staff, including nurses, physicians, and advanced practice providers. We surveyed participants on their preferred mode of engagement in the sessions, and the vast majority preferred the use of the chat box to interact with the group. Only about half of participants utilized the video during the sessions, although this was strongly encouraged. Our team created a webpage that hosted the schedule, PowerPoints for didactic material, and recorded sessions, as well as a toolkit for references for incorporating cancer genetic testing into clinical practice. Organizational readiness was assessed using the ORIC survey. Most participants agreed or somewhat agreed that their organization was committed to implementing point-of-service genetic testing in their clinics. There were more neutral responses, neither agree or disagree, to the perceived ability of the organization to implement change. Higher levels of evidence measuring knowledge and competence were demonstrated by self-reported improvements in use of evidence-based care and guidelines, more timely and higher completion rates of genetic testing, and incorporation of shared decision-making concepts into practice. All participants reported good or outstanding level of achievement in these areas after session 5. We saw lower levels of engagement in the process improvement portion of the project and determined this was impacted by having an identified clinic champion, organizational commitment from their cancer center, and a motivator such as accreditation or business development. ePost BC demonstrated that rural and community oncology providers are interested and willing to engage in telementoring, and this improves provider knowledge and implementation of point-of-service testing. We saw that measuring higher levels of change, such as testing completion for eligible patients in a practice, is difficult in a community setting without intensive data collection. One of the limitations of this project in using Project ECHO, which is a platform that was designed to reach low resource settings, is measuring metrics in a quality improvement process. We also saw a low response to surveys. Next steps include the incorporation of technology and standardized tools into practice to address provider and care team burden of delivering genetic education in the clinics. Thank you for your time today. We would like to thank our supporters, including Pfizer Independent Grants for Learning and Change, the Association of Community Cancer Centers, and the Masonic Cancer Alliance. Ongoing gratitude to our EPOS team.